Have you ever laid in bed at night trying to figure out why you can't sleep? Was it doing exercise right before bedtime, the coffee you had late in the afternoon, or going on your phone right before bed? There are some reasons you're already aware of, things you have suspicions about, but also variables which you don't know that affect your sleep. There are also other problems you may not know the exact cause of, as many variables come into play, like migraine, weight gain, or joint pain. For the last 9 months, we have been working on the challenge of how might we help people with narcolepsy to predict and manage their condition. Narcolepsy is a neurodegenerative condition where the brain is unable to regulate sleep phases. For people with narcolepsy, there are numerous other severe symptoms to try to make sense of, like excessive daytime sleepiness, cataplexy, which is the sudden loss of muscle tone, sleep paralysis, and hallucinations. And narcolepsy is treated by a combination of medications and behavioral changes. And therefore, there are a lot of variables to consider when trying to make sense of the condition and how different things correlate. For example, Lucy, a 24-year-old with type 1 narcolepsy, wants to understand how her cataplexy and sleep paralysis is influenced by her current medication and the stress she's experiencing at university. While Andrew, with type 2 narcolepsy, is trying to figure out how his diet in combination with his medication influences his current situation and his excessive daytime sleepiness. It can take a really long time to understand how various aspects of your life influence your well-being. And our vision is to empower people with narcolepsy to understand their condition, manage their lifestyle, and participate in society on their terms.
And this is why we came up with Habitual, your narcolepsy companion. Habitual helps people with narcolepsy to learn about their individual condition and understand how their symptoms, habits, medications, and other factors play together. Tracking of symptoms can be a burden. That's why we talk to hundreds of patients to make it as efficient and enjoyable as possible. We have created a default set of questions which provide an holistic view of the most common narcolepsy symptoms and other factors of their day. Since narcolepsy is so diverse, we have made it fully customizable. Therefore, Andrew only tracks what matters to him. The main benefit for the user is not the tracking, but rather the insights they can gain from the data. We've achieved this by visualizing the data in a meaningful way. Thereby, the user can explore their data on their own and find correlations between various parameters. Based on the knowledge we gained from desk and user research, we've also developed ways to merge the data into aggregated indices and support other state-of-the-art scores. This enables the user to see how they are managing their condition in a more objective way and enables Lucy to understand how her cycle influences her cataplexy. Throughout our research, we have learned that behavioral changes are a fundamental part of managing narcolepsy. However, finding the right information is not a trivial task. That's why we have incorporated various sources of verified information into our solution, like managing sleep hygiene, setting a daily routine, and starting with exercise. We can therefore support Andrew to develop a diet that fits him best and reduces his excessive daytime sleepiness. Doctor visits are usually short. This is not different for visits at the sleep specialist. Currently, most of this time is used by the practitioner to get a picture of the symptoms experienced since the last visit. They therefore strongly focus on a subjective recollection of the facts and are highly biased by the current mood of the patient. As these visits only take place once or twice a year, this is not a very reliable source of information. We talked to numerous practitioners and sleep specialists, and through an iterative process developed a way to combine the gathered data into a holistic report. Lucy's doctor can now gain knowledge about her symptoms faster and in higher quality. Therefore, they can use more time to focus not on the past, but on the future treatment. We developed Habitual for our corporate partner Takeda and want to use this chance to thank our liaisons Lu Zheng and Lana Karna. We are Juan, Vicky, and me, Julius, from Hasso Plattner Institute in Potsdam, and Mel, Minami, and Ethan from Design Factory, Melbourne. Thank you for your attention, and we would like to invite you not only to our booth, but also to try Habitual out yourself.